We turn now to the coronavirus pandemic. The death toll in the U.S. climbed above 201,000 today as nearly 1,000 new deaths were reported. On Capitol Hill, top U.S. health officials told senators that they themselves would take a COVID vaccine when it's approved and that there's growing optimism that a vaccine will prove safe and effective by late this year or early next year. We get more now from CBS's Mola Lenghi.
Today, the nation's top health officials in the hot seat.
In the end, FDA will not authorize or approve a vaccine that we would not feel comfortable giving to our families.
If I take a shot to get the vaccine, does that give me COVID?
Absolutely not. That would be impossible.
The head of the National Institutes of Health, Dr. Anthony Fauci, sparring with Senator Rand Paul over New York City's low test positivity rate.
They are looking at the guidelines that we have put together from the task force of the 4 or 5 things of masks, social distancing, outdoors more than indoors, avoiding crowds, and washing hands.
Or they've developed enough community immunity
Right.
that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator, because I want to, please, sir, I would like to be able to do this because this happens with Senator Rand all the time. You were not listening to what the director of the CDC said, that in New York, it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
As drug makers race to develop a vaccine, the FDA is expected to issue tougher standards for approval.
FDA will not authorize or approve any COVID-19 vaccine before it has met the agency's rigorous expectations for safety and effectiveness.
I think that's going to take us April, May, June, possibly July to get the entire American public completely vaccinated.
Today, Johnson & Johnson became the 4th vaccine maker to begin the final stages of trials. Their vaccine would require a single dose and not have to be stored in sub-zero temperatures, unlike other vaccines.
Even if we do this so fast, it's still done very rigorous. We don't cut corners. We do what we need to do in order to show safety and efficacy.
Well, new cases continue to rise, now in 28 states, plus Washington, D.C. and Puerto Rico. There's also an uptick here in New York City, where 20% of those new cases are concentrated in just 4 neighborhoods, Nora.
Mola Lenghi, thank you.